I had good and bad days. On a bad day, I wouldn't leave the house. Sometimes I'd cry, or sometimes it would mean that I wouldn't cry when I needed to cry. Periods of self-harming as well, at times, when it got really bad.
It was very dark and very black, and almost like being in a hallway with doors that were locked and there was only one door left open.
It was like a combination of things, really. When my dad first became ill, and then I lost my nan, and then I just kind of began to feel bad about myself, really, and that I don't know, I just had like negative feelings about myself quite a lot, and about the world that I was living in.
I just didn't know what was wrong with me. I couldn't sort it. I couldn't get over the hill.
I'd tried several different other types of counselling. I'd had 3 or 4 different types of antidepressants, none of which made a big difference to the way I was feeling.
CBT is a type of talking therapy, and it's for people who are feeling anxious or depressed. It's a way of dealing with your thoughts and your feelings and your behaviour in the now and trying to change them, not in massive ways, but in small, achievable ways. It'll start with you just talking about your life and why you're there, what your aims and what your goals are. Talk a lot in CBT about setting an agenda, and it's up to you to set that agenda.
It was about writing the situations down, and if I'd had a bad day or if something had happened, then it's about questioning what's reality and what's not fictional, because it isn't fictional, it's your interpretation of the situation.
If you're going to do CBT, you're going to have to engage with a certain amount of record keeping, making notes of your thoughts, thinking about relationships between thoughts and behaviour, and seeing how that can be changed.
So these are all my notes that I keep, and I refer to my coursework and things, exercises that I did throughout my CBT training. A lot of the tools that I use are to do with almost like a court, and what actually happened, and reviewing the situation and reviewing how I reacted. And I still do that now.
I had this thing in my head that I had to be strong all the time. As I learnt to accept that it was okay to be upset and it was okay to feel like I was feeling, it became easier.
You accept other people's faults, but you don't accept faults in yourself, and the bar that you set for yourself is not achievable. I always thought I had to be this size, long legs, I had to be brainy, I had to be perfect. And it isn't the way life is. It isn't the way I am.
It's about rethinking and changing your thoughts and feelings and putting them into context, really. It made me think very much more what was fact, what was my feelings. I just think it was fantastic, and I just think that by having that experience, it's made me a completely different person today.
If there's one piece of advice I would give to people about psychotherapies, don't be afraid to ask your doctor about it. It is available.
I think it will teach you things about yourself that you never knew, and it will teach you how to deal with anything life throws at you.
If you can go to get some help and some support, then it will change your life.